Hello and welcome to the first interview with the Redefining Sobriety Summit. My name is Caitlin Paget. I'm your host, and I am super honored and excited and grateful to welcome Dr. Delafield to our summit. And for those of you that don't know about who Dr. Delafield is, she is a board-certified family physician who received her medical degree from Oregon Health and Science University and completed a residency at the University of California, San Francisco in family and community medicine. In terms of Western medicine, she was honored to have received excellent training in primary care medicine, one that taught her to consider the social, cultural, spiritual, and political context within which each of her patients is living. Beyond that training, however, her practice of medicine is infused with a passion for treating the whole person with multiple modalities, conventional and complementary, to achieve profound transformation and healing. She practices a broad range of medicine, including primary and preventative medicine, urgent care, and women's health and options counseling and addictions recovery medicine. She has years of personal and professional experience in the field of detox and addiction medicine and has continuously felt a strong pull to working with those struggling with addictions. This includes a passion to promote all approaches to addiction, including education and prevention, improve access to care, and promote harm reduction and risk reduction, to providing the most evidence-based treatment modalities to obtain lasting recovery. Welcome, Dr. Delafield.
Hi, thank you. Thank you, Caitlin, for having me.
So you and I, obviously, we have had many conversations on this topic and many other topics. And, in your bio, it makes it clear that you have a pretty open approach and maybe even what we would term kind of like a bit of a more progressive approach to addictions. And before we get into answering some specific questions that might be really directly relevant to what we're doing here with Redefining Sobriety, I would love to just ask you a little bit about your personal story and how you feel that has shaped your philosophy in terms of how you approach medicine and addictions medicine specifically.
Yeah, absolutely. So I apparently wanted to be a doctor from a very young age, but I left home when I was about 13 years old and dropped out of school. And part of my process was struggling with addiction, including alcohol. And it wasn't until I was in my 20s, well, about 20, that I got sober and really started utilizing some of the programs in my area to decide that I wanted to go back to getting an education and pursuing my life dreams. So during that time, I considered becoming a naturopathic doctor. It seemed to fit my interests. However, when I looked at the population that I would be working with, as well as the financial factors, I determined that allopathic school was a better fit for me, not ideologically, but because I needed to be able to have a way to pay off my loans. And I also wanted to reach the broadest population. So that's when I decided to pursue a career in allopathic medicine. And I wasn't, during that whole time, I was also working on my recovery from substances and alcohol. And I did a lot of work in the field, everything from detox to peer mentoring when I was first getting started. And I came in obviously with my own experience and my own biases. And as I've progressed through my professional career, I've tried to find ways to be aware of those biases and use my story and use my experience, but really balance that with evidence-based approaches, because the number one thing that I always want to be aware of is how can I help the patient that's in front of me. And so I really think that I walk between those two worlds of personal experience and utilizing evidence-based medicine to present the most applicable solutions for my patients.
Thank you so much for sharing that. And, I know that it's something that I've always appreciated as well when I have conversations with you, is that I feel that you're in this sort of constant process of self-inquiry, and also with your professional experience and obviously your years of study. And it's so helpful to me because I feel as though I've come into this work really intuitively in a lot of ways. And so I know that I always appreciate and love to be able to check with you, because you also bring in both you bring your personal experience, but also your professional experience, and your constant updating of that as well, in terms of seeking the best approach for any given person that you're working with. And that leads me to my next question, which is really that in order to be able to provide what would be the evidence-based and quote unquote, like in the simple terms, like best approach for somebody's treatment, or somebody who's interested in addressing their relationship to alcohol, for example, I think it's really important to know what it is. First of all, obviously, as a doctor, you would probably use the words like diagnosing, but you and I have talked about how it's really important to call things for what it is, or for what they are. And there's so many different terms floating around right now, like alcoholism, substance use, alcohol use disorder. And I would love if you can kind of clarify what some of those different terms are, and what they mean, so that we can start kind of calling things for what they are in terms of what the medical definition would be.
Yeah, absolutely. So I think alcoholism is probably the most common term that we know in layman's terms. It's been used since the late 1800s, and generally it is referring to the addiction to alcohol and the consumption of alcohol that is caused by compulsive behavior. And it's usually referring to an alcohol dependency. And so as alcohol addictive behaviors or disorders have been moved into the medical realm, the psychiatric realm, we've tried to create ways to talk about addiction. And so addiction in general now is really considered a range of disorders. It's classified by the DSM-5, and the way we talk about alcohol use is alcohol use disorder, and it really is a continuum. So rather than looking at one person saying they're just abusing alcohol, and then another person saying they are dependent on alcohol, and that's how it used to be, we've rolled it all into one continuum, so that in each patient we can try to determine where they are on that continuum. So in discussing the specific definitions, you're right. Everyone has, if you look at the Institute on Drug and Alcohol Abuse versus SAMHSA, everyone has a different way they discuss it. But from a medical standpoint and a psychiatric standpoint, mental health, we generally refer to alcohol use disorder. And then looking within that, we really are looking at a couple different things. We're looking at consumption amount versus the effects and the outcomes. So, for instance, when we are talking about the amount of alcohol, there's generally, for the purpose of this interview, I'd like to put it in 3 categories. So there's low amount or low risk drinking, and that would be considered no more than 1 drink a day or no more than 3 drinks in one sitting. So that would be someone that is a very occasional drinker, and they are not drinking multiple drinks in a sitting, or if they do, it's extremely rare. The next category would be moderate amount of drinking, and that's greater than 7 drinks in a week, or having 4 or more drinks in one sitting at least once a month. We also call that binge drinking. So a binge, and a great place to look for exact definitions is on the NIDAA website. So a binge is considered for a woman having 4 or more drinks in one sitting. And that level of drinking, we know, is linked to increase in bodily harm, accidents, poor health outcomes, sexual risks, etc. The last group would be heavy drinking, and that would be people that are having those binges that I mentioned on greater than 5 days in 1 month. So just to put that in context of the population we're talking about, which is, you know, young women, which I believe is your population.
I'd say women in general, but
women in general.
Yeah.
Okay. So the scope of problem is pretty large. So about 16 million people in the United States have an alcohol use disorder, and about 5.5 million of those are women. And so those women are going to fall into the latter two categories. The first one wouldn't really be considered an alcohol use disorder, and the second two would be. So 4 more drinks in one sitting on greater than 5 days in 1 month. There's a lot of women that meet that criteria. I mean, if you look at your typical just social drinker that's having, you know, a dinner party and going out to the clubs twice a week, that does push them into that category of heavy drinking. However, when they get in front of a mental health provider, that's when we actually pull out the DSM-5 and look at the criteria for alcohol use disorder, not on amount that they're drinking, but on the other external factors that are going on. There's 11 criteria we use, and I won't read them here, but they are looking at tolerance, craving, social impact, if people have difficulty cutting down, as well as dependency. So that's how we really determine if someone has a possible medical diagnosis of a brain disorder that's impacting their brain. So I know that it is tricky, but I think on one hand we look at just plain consumption, like how much someone is drinking, and we say it's either low risk, moderate / binge, or heavy drinking. And then the other way to look at it is actually trying to tease out the subtleties of the effect it has on the person's life. And that's what we're doing with the DSM-5. So hopefully that kind of clarifies that a little bit.
Yeah, that's really helpful. Thank you. And I think it brings up an interesting question too that I know you and I have talked about before, is how many women, I'm assuming men as well, but you know, for the purposes of this interview, women, and I know I gave you the example last time we talked that I've been in that chair in the doctor's office or with a professional, and you know, being asked, you know, do you smoke, do you drink, and how much drinking is underreported often because we might be afraid of what we're going to be told we need to do. Or I think there's a lot of people who don't even really know what's considered, you know, moderate or high risk drinking. As you said, like what you've described is just considered normal drinking for a lot of people.
Right.
You know, like that's just what I do socially.
Right.
So there's a lot of misinformation out there in terms of what is actually considered a risky amount to be drinking. So I do think it's very helpful that you've clarified this for us. And I know a question that's on a lot of people's minds is really this whole question of, well, so let's say somebody's listening to this and they're like, okay, you know, maybe at times I've been in that category of heavy drinking, maybe not right now, like I've managed to pull it back. Maybe I fall somewhere, you know, I like, you know, oscillate between low to moderate risk sometimes, you know, but I know that I struggle. Like I know that I keep repeating certain patterns. And a big question on a lot of people's mind is, I think, like, can moderation work for me? Is
Mhm.
this a viable option for me? Or because I'm somebody that has struggled with alcohol before or continues to have some repeated struggles with alcohol, do I have to cut alcohol out completely? And I know this is not a short answer, but I'd really
Mhm.
love to hear your medical perspective on this question that I know is on a lot of people's minds.
Yeah, so that's an excellent question, and this is probably really where the heart of the work comes in terms of addiction medicine, because there's a lot of subtleties and it's hard to tease out in our patients. So what we're finding out more and more as we have more studies on brain physiology and gene and DNA testing, we are able to recognize how alcohol use disorder is being occurring in the brain. And so I'd like to just, the short answer is that there is this invisible line that people tend to cross that has to do with their brain chemistry that makes moderation or cutting down on alcohol or any substance very difficult, because anytime they're having any substance, it is affecting their limbic system and the way they process substances. So determining whether people have crossed that line is really challenging as a provider. And oftentimes the patients themselves know before people around them do. So a little bit more about the way alcohol affects the brain on the long-term scale is basically, we know that people that struggle with alcohol use disorder or dependency, they often have genetic predisposition as well as environmental factors. So there are people that, due to their genetics, they have these single neuropeptide transmutations. And what that is, it's just a one area protein gene mutation that's often passed down from their parents. And because of these mutations, the way that they experience pleasure and pain are altered. It ends up affecting the presence of neurotransmitters such as dopamine, GABA, and glutamate. And those mutations are passed down. So when people have those mutations, we know that basically makes them a higher risk of developing an alcohol use disorder, because it's affecting the pleasure pathway in the limbic system. So when they take their first drink or use a substance that can create, pleasure and habit forming and dependency, the pump is primed, so to speak. Then, as they are drinking with their chronic alcohol consumption, they actually have changes in their brain that includes increasing glutamate receptors and then also reducing the number of other receptors, like GABA receptors. And that's all just like scientific jargon, but what that means is that once they do that, those are permanent changes. Mm-hmm. So every time they drink, it's going to affect them differently than it would someone that doesn't have those changes. So the idea of who can moderate and who can't really is probably, and obviously I can't say with a surety because this is all a developing area of science, but it probably is just that. It's not it's a brain chemistry question, and it's not a question of morality or character or if someone has stronger willpower, but it really is coming down to the molecular level. So that being said, how does someone themselves know? And I think we've talked about this before, that if someone gets a signal in their life that they want to try to drink less, and they try that multiple times and they are unsuccessful, it may be an indication that they have some of these changes in their brain, and that moderation is going to continue to be unobtainable for them. So I think one of the best ways is trying moderation and seeing how it goes. It actually lays that out in the Alcoholics Anonymous book. Their test for alcoholism, I don't know if you're aware of their test, but they recommend a trial of controlled drinking, quote unquote, which is moderation. Mm-hmm. And if the person is unsuccessful and they find that they're unable to moderate, then, you know, they would say, well, maybe they would benefit from their program. And I would say maybe it's indication that they have a chronic disorder at the level of the brain, and that they need to seek further help. Mm-hmm. I hope that's helpful.
Yeah, that's really helpful. Thank you. And it leads into another important question, I think, which is, you know, when somebody is trying controlled drinking or moderation, you know, we also know now that simply just trying to cut down on the number of drinks without changing anything else in your life is also, you know, potentially setting yourself up for it to be really challenging. So there might be the question of the brain chemistry, which might be preventing some people from being able to really successfully moderate because of all of the reasons you just described in terms of the chemical reaction and the genetic reasons that are happening in their brains. But, you know, I know something that I've seen a lot, or when I've spoken with people who first reached out to me and said, well, have you tried taking a break? Yes. Or have you tried moderating? Yes. Okay, great. You know, how did that go? Well, it was really hard. Well, what else did you try doing differently other than simply cutting out the alcohol? And so sometimes it's a question also of having other supports in place. And I know you have a pretty clear, you know, like definition of what a program or what sort of a plan of recovery that's like to obtain like moderation, but what that needs to include in addition to like trying, like making the decision to try to cut back, but then what else should somebody try before they maybe start? Mm-hmm. Do you know, am I making sense? You know, like there's other things we need to have in place.
Yeah. So one of the things that we've talked about in the past is that when people some people really have environmental factors that in that moment are causing them to drink. And I've seen people that, or drink more than they normally would. I have seen patients that maybe have not had chronic brain changes taking place, but they have had environmental factors that they've had no other tools to deal with their emotions other than maladaptive coping mechanisms such as using substances like alcohol. So for people like that, especially, one of the most important things is trying to find positive ways of dealing with stress and emotions. You know, there's so many people that they actually don't have hobbies, they're not physically active, they don't have a spiritual interest in their life. And it doesn't take all of those things, but it takes someone having something other than the fastest, easiest approach, which is just to take a drink or use a substance. There needs to be something else that they can do to deal with emotions of stress. And that's something I see all the time. You know, most people are overworked, overstressed, and they're not carving out time in their life to have positive friendships, to have positive activities, to have ways that they're able to process their emotions. So it's much easier. It takes 5 minutes to down a shot, you know, or a second to down a shot, you know,
pour
a few minutes to down a glass of wine.
Mm-hmm.
So, so I think that, you know, some of the things that people can do if they're really trying to cut down on the amount that they're drinking would be finding a group of peers that are doing the same And that can be through a sport, a dance activity, community involvement, mutual support groups, and it can be through things such as the services that you offer. So just finding people that can help both offer distraction or guide them. But I think that, it definitely takes an active effort to change behaviors and looking for activities to do other than drinking. So it does take positive action, and sometimes people aren't successful only because they really don't know what else to do. But reaching out, talking to people, and finding out what's worked for other people is always really helpful.
Yeah, so what I'm hearing, just to summarize, because I know we're coming up on the end of our time, and I just want to say I really appreciate you taking the time because I know how busy you are. But, basically to summarize, this is going to be coming out on the first day of the summit. So, if somebody's listening to this and they've considered making some changes, or maybe they've tried making some changes before, the kind of the short answer around how to approach this might be to see what else you can try, whether there's other activities, whether there's, some sort of social component, some sort of stress relieving component, to really look at, okay, if I'm not drinking, first of all, maybe what was I trying to achieve with that drink? And then how can I start to develop these other tools and a support system around that, if moderation is my goal, to really support changing my relationship to alcohol, my drinking. And then if I'm still finding it really, really challenging, it might be recommendable then at that point to reach out to a doctor, to an addiction specialist, to somebody who might be able to give them further advice and support, and possibly identify if, maybe you are a candidate for trying abstinence, if you've really given it a go and kind of given it your all in terms of really making some of the lifestyle and mental shifts around your drinking, but you're still finding it's really, really hard to moderate. Would that be kind of like the short answer of where to go when somebody's looking at redefining their relationship to alcohol?
Yeah, absolutely. And I think that, yes, especially because not many people are going to be able to be abstinent if they haven't failed moderation. There's very few people, unless they never drank in the first place, that would be able to say, oh yeah, I'm never going to drink again, when they haven't tried to moderate and failed. So I think, it's always good to let people try in medicine in general, we try the least invasive approach. So the thing that's going to have to be the least difficult for someone to accomplish. So absolutely, if someone comes into my office and they say, hey doc, that this is what's going on, I'm struggling, and we determine that they are drinking at more than the recommended amount, but the first thing I'm going to do is recommend that they try cutting down, and hope that I can help them have resources to be successful, and I think that that's always the first approach, is to see if that's an option for them, because otherwise they're not going to be successful at abstinence if they haven't already failed moderation, if that makes sense.
Mm-hmm. Yeah, it does. Well, thank you so much. I know that there's so much more that we could cover, and this is really just the beginning of a very, very important conversation. And I'm grateful that you were able to share your knowledge on this topic. And I know that you offer this in your practice as well. And we'll have some information on some of the links that you've mentioned so that people can learn more, if they're interested, about the kind of the science behind addictions medicine and some of the, because this is a lot of information. It was very rich with probably what is new information for a lot of our listeners. So I'll make sure that we have some links beneath to send people if they want to continue deepening their knowledge on this topic.
Great. Thank you so much for having me, Caitlin. I really appreciate it.
Thank you.
Take care.